Welcome to Inside Urgent Care, the podcast that shares stories from within, you guessed it, the side of healthcare we all know and love, urgent care. This is the space for you to hear inside perspectives and authentic conversations from those working in the space. Thank you for being here, and let's get into it.
Today's episode is the evolution of urgent care, and we're joined by Kellen Kreger, Director of Telemedicine at Well Now Urgent Care. Kellen has extensive experience within urgent care and the evolving technology of delivering on-demand healthcare. Welcome to the podcast, and thank you so much for being here.
Thanks, Samantha. Happy to be here and to be able to talk urgent care and telemedicine.
Oh, fantastic. So can you give us a little bit of your background and path within urgent care?
My path started as a physician assistant. I went to college at Pennsylvania College of Technology in Williamsport, and that was around 2007. Originally coming out of that, I knew that I wanted to be in emergency medicine, so immediately jumped into that in 2007, started at Arna Ogden Medical Center in Elmira, New York. Worked there in the fast track. Probably a lot of people can recognize a lot of the patients that we see in urgent care now. We used to see in what they would call fast track in the emergency room, which I think that they still run some of those, but not as heavily as probably they were back then before urgent cares. Around that time, urgent care was still kind of new to medicine, and we didn't see a lot of that stuff. And we would see most of those patients in the emergency room during that time. So I worked there for until about 2013, and then I transitioned to Well Now Urgent Care, when at the time we were actually five-star urgent care at that time. And since then, I worked at the Elmira, New York location, mainly took over the telemedicine department in 2017, I think, is around that time, and became the lead medical provider for three of our clinics. And then during the telemedicine kind of really took off, probably as everyone expected, or saw, I should say, back in 2020, at the start of COVID. We had a hard time kind of gaining traction during that time with telemedicine. And I remember we used to get about 2 to 3 visits a month. And we were gaining ground slowly until about 2020 came. And then after that, we went from seeing like 1 to 2 patients a day to about 40 patients a day. And since then, telemedicine was really kind of pushed to the forefront as a solution for healthcare and in COVID or since COVID. And since then, I've been in 2021, been the director of telemedicine. We've been kind of growing that service line since then. So that's kind of been my path through urgent care.
Yeah, thank you for that. So speaking of telemedicine, how have you seen it evolve? I mean, I know that our telemedicine visits in urgent care, they really peaked right around the beginning of COVID and throughout COVID, but where are we at now and where do you see it going?
Definitely. I think everything is kind of, the convenience of it is what really appeals to a lot of people, as in anything else in our society. Everything kind of gets more convenient and people really like that. So I really see it kind of progressing that way because it gives you more access and it's easier to access to.
Mm-hmm. Yeah. So what has surprised you the most about working in urgent care over the last 10 plus years?
I think the evolution of it, from becoming something that wasn't really an option for patients initially to something that's kind of become mainstream and a staple of the healthcare system, because now it really bridges the gap between the emergency room and your primary care physicians. And back then, there wasn't anything to bridge that gap, which is why you saw these start to become a necessity. And with primary care struggles to get patients in, especially sick visits, they had less options to turn to. So since then, that evolution of urgent care to fill that gap between that primary care physician and the emergency room has been a unique experience to kind of witness and be a part of.
Yeah, I can imagine. And speaking of the evolution of urgent care, are there any specific ways you've really seen the practice evolve? And what's kind of been the same? What's kind of stayed consistent throughout the years?
Yeah, I think starting with how it stayed the same, I think the core of what we do, which is still seeing the acutely ill patients and fill that gap between that primary care and the emergency room, that will always be fundamental to what we do and follows that typical kind of flu, cold, seasonal pattern that we're all probably used to seeing with our volumes and being, really busy during those winter months and maybe not as busy in the summer months. So that really kind of remains that core for us. How it's evolved. some of these we were already doing when I came into the field, but I would say that we probably do more of these things now. I've seen urgent care expand into multiple areas to be able to service patients. It's easy for me to call out telemedicine and our in-clinic usage of telemedicine, not just at home. Initially we didn't do anything with our telemedicine team inside of the clinics, and that actually really changed when it came to COVID. The different types of services that we actually provide for patients too. So occupational medicine, I see a lot more urgent care is willing to kind of move into that and to service patients from from that realm. DOT physicals, workers' compensation, some of those things that kind of go close with urgent care, but are more around the occupational medicine is where I've seen a lot of those things evolve. So
Yeah, truly kind of expanding into a bunch of different areas I've noticed in urgent care, even doing more primary care type services as well.
yeah, absolutely. And along those lines, like increasing the lab offerings that are at certain clinics, like initially we only had certain point of care testing. Now you see a lot more in-depth labs for patients that they can come to us for. And just the expansion of services too. Because initially when I started with this, Medicaid was actually something that wasn't routinely accepted at the urgent cares, and I see that a lot more now. So allowing us to reach more patients, and definitely patients that have that need and need that access. So
Yeah, very true. What do you think is coming next for urgent care? Maybe that's on the tech side, operationally, maybe a combination.
um, urgent care, it's always hard to pinpoint what will change, but I
Yeah.
think more value-based offerings probably for patients, and this may be more cash-related self-pay options to avoid sometimes those high costs of insurance, or letting patients be able to sidestep some of those high cost deductibles. Um, On the tech side, I think this goes for all of medicine, probably not just urgent care, but I can see a bigger focus on the patient experience from a technical perspective. Specifically, like if you're making it more convenient and visible for like wait times at a center, or how easy it is to get in and to schedule, and helping with balancing maybe some of that busy time so that way we can spread waits out. I think that there's a lot of push into that. Medicine, as far as the patient experience is concerned, when compared to the consumer experience of like a Uber or Grubhub, leave some things to definitely be desired.
Yeah, just kind of bringing them throughout the experience, kind of hand holding. Is that more what you're thinking? Like, because I think about those experiences and it's just updating you every single step of the way and making it super easy for you to get what you need without a lot of effort on the consumer's part.
Yeah, exactly. You want to be able to get them in and be able to schedule that as easy as possible and provide them as many options as you can too.
Hmm.
Transparency is always a good thing.
What has made you want to stay working within urgent care?
This has always been a good balance for me, I would say. I've always been interested in emergency medicine, and I think that comes from when I was young. My parents were very heavily involved in volunteer ambulance associations and fire company and stuff. So I started as an EMT when I was younger, and ER is the type of medicine I really prefer, and I like that higher level of acuity in that challenging environment. But really, urgent care gives you a lot more flexibility, I would say. Offers you a few more things than what just the emergency room can do, and you still get that acuity. Still run into the myocardial infarctions, you strokes. You still run into that, but you move that into the emergency room as fast as you can. So
Yeah, I can imagine that in the ER, you know that you're going to get emergencies constantly every day, but in urgent care, you really don't know what's going to walk through the door and that level of acuity, and you kind of have to know a little bit of everything.
yeah, you have to be prepared for everything, and it's nice to be able to do the procedures and stuff too. Still, so keeping those skills up that we use in the emergency room, like suturing and abscess drainage and some of those things.
Yeah,
Those are things I didn't want to lose, but I've never really had an interest in surgery, so I knew I wasn't going to go that way to get the ex more experience. So
right. Yeah, that makes total sense. If anyone listening to this now might be considering working in urgent care in the future or switching to urgent care, what would you tell them or what advice would you give them?
uh, I would recommend it. I think that urgent care gives you a really broad base to be able to practice medicine and keep your skills up. Like you said, you're going to run into anything that really comes through the door. You have to be prepared for it, and you have to keep those procedure skills up at the same time, you're going to run into those acute cases that need immediate intervention. You're going to be able to do some occupational medicine. You're going to do wet reads, EKG reads, just to name a few of those things that you can do. So I think that those skills that can kind of get lost in a corner of medicine sometimes, I, and the flexibility actually of how many different areas that you can move to in the country with these, because they're popping up everywhere. So it's definitely a mobile field.
Yeah, that's a really good point, actually. I mean, urgent care just continues to grow and grow, and they keep popping up, so there is a lot of flexibility in that regard.
Yep, and people are always going to be sick, so there's always going to be a need for urgent medicine.
So what are some current trends you're seeing?
So the one trend that I could think about was the X-ray technologist shortage. You know, that everybody's probably feeling throughout healthcare right now. It's not just something that's probably impacting urgent cares or just us, but you know, it does impact our patients. So it does cause a little bit of delays sometimes in being able to get those X-rays done for patients who have, you know, acute orthopedic injuries. So that's one thing that we've seen and we've tried to address and tried to manage to be able to still give that or bring that service, as there definitely is a shortage out there for X-ray technologists right now.
Yeah, that's a nationwide issue right now, definitely. And are there any sort of trends that you're seeing visit-wise?
I would say our typical season trend right now, I'm up in the Northeast, so we're deep into winter right now. You know, we came out of the probably the busiest time of month, is right always after Christmas and beginning of January. So coming out of that and just seeing kind of like a steadying of our volumes at this point in time, with flu going down just a little bit, which has been kind of nice. So.
Is there anything else that you would like to share or that you're seeing or anything from your decade of experience in urgent care?
Yeah, so there's one last thing I would like to kind of touch on, was the opportunity that I was afforded to me as a physician assistant, and that I'm grateful for it, and for what urgent care has been able to provide too. So in the emergency room, I became the lead provider for like the physician assistants and nurse practitioners, which essentially meant you kind of did the schedule, and orientation and training. You know, when I came to urgent care, that was different. The opportunity for advancement to management and non-clinic positions can sometimes be a little bit limited for physician assistants and nurse practitioners in hospital systems. Specialty practices and family practices, that can be a little bit tough. Typically, those roles are usually held more by MDs and DOs in larger systems. So I think urgent care has really afforded a lot of advancement to management and in-clinic positions or I'm sorry, non-clinical positions for PAs and NPs. Definitely in my company and in other companies too. So I think if that appeals to you, I think that urgent care offers a unique opportunity, to be able to advance in management for, physician assistants, nurse practitioners. And I know a lot of mid-level colleagues in management positions at my company, and that's the one thing I've been grateful for in urgent care.
That's a really great point. And yeah, there's a lot of PAs and NPs that work within urgent care. And just personally, I've had some really great experiences when I visited urgent cares and been seen by NPs and PAs. So it's nice to see them be able to move up within urgent care, maybe in a way that those positions really aren't able to in larger systems, like you're saying.
From a profession standpoint, it's nice to see them rewarded for that hard work.
Well, thank you so much for being here and sharing all of your experience and expertise. And listeners, thanks for listening in. Talk soon. Thank you.